Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program here on 96.5 FM, Power 96.5 FM, and 1080 AM WUFO. I'm your host, Francesca Messiah, Manager, Workforce Development from Kaleida Health. Kaleida Health, I still get that question. People still aren't sure what Kaleida is, and that's why I review it every week. We are Buffalo General Hospital, Oishei Children's Hospital, Millard Fillmore Suburban, Gates Vascular Institute. We also have the 24-hour care in your home with the Visiting Nursing Association. And we have two long-term care facilities. That's High Point, corner of High and Michigan in Buffalo, and DeGraff. Memorial and DeGraff long-term care facility in Niagara County. Also at DeGraff, we have an ER, 24-hour urgent care. I should say ER, it's an urgent care facility, also on the property of DeGraff in Niagara County. We have oncologists, we have social workers, surgeons, and also if you are, I just have to add this, if you're thinking about changing careers, or if you're looking for a job, please visit www.kaleidahealth.org. And then underneath, you will see careers. Click on careers, where we have over 800 positions available, ranging from careers and jobs that require a high school diploma or a GED, all the way on through a PhD. So check out that website. Well, we have our guest for today, our first guest this half hour, no stranger to the program, and that's Kelly Cardamone. Good morning, Kelly. How are you?
Good morning, Francesca. I'm doing well, thank you. And thanks as always for having me.
Oh, you're welcome. Kelly is a registered she's a clinical nutritionist and diabetes program manager with general physician's practice. She has an office right here in Buffalo on the bus line. Great. She's a wealth of knowledge and working on her PhD in nutrition. So she is an expert. And then in our second half hour, don't hang up. Please don't hang up after the first half hour, because our second half hour today, we have Dr. Fred Archer III. He's a pediatrician, and our topic in the second half hour that starts at 7:30 is maternal and infant mortality. Well, I'm with our program today where we're talking about maintaining your healthy GI digestive system. So, Kelly, briefly, what is the body's GI, and what happens if your GI is not well maintained?
So the gastrointestinal system, and many people think of it as it's just your stomach, right? But it really is complex. Yeah, it's a network of organs that helps you digest, so basically break down and absorb your food. And it's really connected from your mouth all the way to the other end at the anus. So it's basically in one end and out the other. But if you think about it, there's a lot that goes in there. Then it packages up the waste from when you eat your food, and then it excretes it out. You get your bowel movements. It really contains two systems. So you've got your gastrointestinal system and then the biliary system. That's your gastrointestinal tract. So to give you some idea of what, again, people think it's just your gut, but what organs are in there? You've got your mouth, esophagus, your stomach, your small intestine, large intestine, and then you get into the liver, the gallbladder, the pancreas, and the bile ducts. So there are a lot of organs that really help the body do this job. And right, it's necessary to break down the food because we need that energy and nutrients in order for the body to function optimally. So, so what happens if it's not well maintained? You asked, right? So sometimes the symptoms are really subtle, and it can impact daily life. So you got to think about there's a lot of organs in there. I mean, you can have really more chronic diseases and milder diseases. Some are going to be just symptoms. So some people get IBS. Some
Which is
people
irritable.
irritable bowel syndrome. You might actually have IBD, which is inflammatory bowel disease, which could be ulcerative colitis, Crohn's. Liver disease is a real common one. We got 25% of the population worldwide and in the US with non-alcoholic fatty liver disease. People get diverticulitis. You might have reflux, which you see it as GERD. So it's reflux, right, where you get that heartburn. There's a lot of things that can happen when that GI tract is not in good health, I'll call it. And the last thing I just want to throw in there is everybody, doesn't remember or doesn't even think about. So that microbiome, right? That's part of your gastrointestinal system. But your immune system is in your GI tract. 70 to 80% of your immune cells are in your gut, right? So if you keep the GI tract healthy, hopefully you have a good immune system and vice versa.
My cousin saying that his mother, my aunt, had told him once that if you're sick, have a good bowel movement and you'll be fine. So is there something to be said about that?
So good. So I have to tell you, as a registered dietitian, I talk about bowel movements. We call them BMs. I talk about them all the time. Because when you eat, you have to get rid of the waste. And so there is something to be said. Now, just because someone has really good bowel movements doesn't mean they might not have reflux or hernia or ulcer. You absolutely could have those other things. But yeah, a good bowel movement means things are moving like they should. You should have a good, solid bowel movement daily. There shouldn't be any pain associated, bloating, all that stuff. So yes, I think there is something to be said for good bowel movements and good health.
And I don't want to get too off the subject. So you're saying if, say, it's a weekend and you're just eating a lot of junk, you're eating wings and pizza and a piece of cake, and you do that for 2 or 3 days, that affects your immune system? Is that what you're saying?
Well, how about this? It impacts your microbiome. We know that now. So to put it very simply, that microbiome or microbiota, it's your ecosystem. So it's basically the bacteria in the gut, right? And
Right.
So could it impact your immune system? Yes. Do I think that all of a sudden you'd get sick from that? I mean, no. But over time, yes, it can impact that immune system if there's that disruption as well in the immune cells, but also the microbiome. So that's something short term. Might you feel it? Yeah. I have people that'll say, I've got bloating. Now I've got stomach pain. Sometimes they get constipated when they eat like that, or they might have diarrhea.
Huh. Okay. All right. Well, okay. All righty. I'll leave it at that. And that might be because that could be a whole nother show. I didn't realize the GI affected so many parts. Is GI gas? Is it the same as upper GI as lower GI? And again, GI means the entire from your stomach to the bottommost part of your body, right?
Yeah. So
okay.
Yeah, the gastrointestinal system, again, so you've got gastrointestinal, like I said, in the biliary system. But the thing is that your upper GI so think of upper like stomach and up, but it's your mouth, esophagus, and the first part of your small intestine, which is called the duodenum. And then there's other parts of the small intestine. And then the lower GI is usually the rest of the small intestine, but to be specific, it's called the jejunum and the ileum. And then you get into your colon or your large intestine.
Okay. Like a colonoscopy would then affect your lower GI.
You got it. Yep. And if you did an upper GI, that would be called, when they go through the mouth and the esophagus, that's an endoscopy. So that's an upper GI.
Okay. And I know we've kind of said this, but so how does the GI system become off balance? So let's say, what are some of the more common things that you've seen in your profession?
Yeah.
What could cause a GI, and does it become off balance overnight?
It can. So if you've ever had food poisoning, right, which impacts millions of Americans every year, especially this time of year I'm always the one at the parties that is like, I'm the food police, as I'll call it, because I'm like, we got to put that away and you can't eat that and you have to reheat it properly. So something like that absolutely could cause a disruption, right? Because then you get like a bug. Sometimes when you travel, I had that happen when I traveled overseas and drank water that I accidentally was not supposed to. Oh, it instantly threw off my GI tract for weeks. So yes, it can happen that suddenly, but other things that can happen over time. Medications can impact the GI tract, illnesses, even just again the food that we're eating. So that poor nutrition can impact that GI tract, and that usually takes place over time. Stress is a huge thing that impacts your immune system. Excuse me, not your immune system, your gastrointestinal system. That's one of those main culprits for IBS, or that irritable bowel syndrome. Anatomical issues. So sometimes we have anatomical, we've got twisted colon, things like that. So there's many things that can impact how that GI tract functions.
Yeah, I've heard people say that they have some of these things. Very interesting. Are there foods that have a greater tendency to make the system feel off balance? I mean, we are getting into football season, and many times when people say let's get together for football, it's normally your pizza, your wings, your taco nacho dip with the cream cheese and everything else in between. And your chicken wing dip.
You named all of the things that would cause really disruption. So what it does is so they can be harder to digest. If someone has reflux, and especially like spicy food and fatty foods can cause that heartburn, that indigestion. As I spoke earlier, like they also impact that microbiome. So processed foods, sugary foods, fatty foods, all of those things can impact, how the GI tract functions and how you feel. The standard American diet, right, is SAD. Standard American diet is really the diet that is disrupting the GI tract and causing a lot of our chronic illnesses.
Hmm. Something you just said, which is something that I know I have a very bad habit of not doing, is you talked about reheating food properly. I like cold food. So what foods, and I'm sure there are other listeners who like cold pizza or cold fried chicken. What are some foods that we need to reheat properly if we're not doing that?
So, I mean, things that are left, so things that are like left in the refrigerator, like there are certain things that it's okay, they don't need to be reheated. Like, if you have things in there like, your cheese and yogurt and things like that, right? Like those are all okay. Nothing should be left out at room temperature for more than 2 hours. These are just tips. And if you cook something and you let it get to room temperature, really within that 2 hour time frame, it's got to be put, in the refrigerator. I think back when I was a kid and we used to have pizza and it would be left out overnight and we would eat it the next day. I think a lot of us did that depending on how old you are. And
Right.
it's a terrible thing to do. Things like fruits and vegetables are okay. It's really when you run into things that contain animal products like your creams and meats and dairy, those are really the concern. Like your salad, of course not, right? But if you had a casserole that you made, or you made taco meat, or you had chicken, or you had fish the night before, you really should. I mean, can you eat it cold? Yes, all of us do. But there are certain individuals that really should reheat those items to make sure that they kill all the microorganisms. You got to remember the refrigerator slows it down. That doesn't stop the microorganisms from growing. Like when you are pregnant, if you have if you have an immune compromised system, if your system's immune compromised, those leftovers should be reheated to 165 degrees. But that requires taking out a thermometer and, you know what I mean, putting it in there and making sure that it's 165 degrees. And I'll just throw something else out for pregnant women. They tell them no lunch meats because of very high risk for listeria and other foodborne illnesses. They tell them they're supposed to heat lunch meats up to 165 before they eat them.
Wow.
Yeah.
That, and I was going to ask you a couple questions around that, but this is the first time I've ever heard about heating lunch meats. Never heard about that.
Only if you're pregnant. So, or you're immune compromised, but if not, you don't have to do that. But in general, look at something, look at expiration dates, smell, go by smell and taste. The hard part with that is that as we get older, a lot of our senses are compromised. So my older patients, maybe their sense of smell isn't as good. So you can't always use that as the way to tell, or that meter, I'll call it.
Mm-hmm. Well, yeah, and people like me, I haven't been able to smell food for the most part in years. I walk into a restaurant, let's say an Italian restaurant, I'll smell spicy, I'll smell garlic, something garlicky for about 30 seconds, and then after that, I don't smell it at all. You
Yeah.
know, so I never even thought about being a little more, just being aware of what foods, just go by the expiration date. That's my best bet is the expiration date. Um, oh, okay, all right. How would someone know if their system was off balance? Is that only, and I ask that question because there are so many commercials, and I guess for lack of a better words, commercials like, well, if you can't, swallow or can't do this, take this pill, take that pill. So it seems like there's a lot of self-diagnoses, remedies on our television. But
Yeah.
how can you really tell what's going on?
I mean, first and foremost, if you're having significant symptoms and they are really impacting daily living, or you find that something's worsening, absolutely speak with your provider first off, and then definitely go see a gastrointestinal doctor. So, as you mentioned, I'm doing my doctorate, and I really had the pleasure of, I had to do a residency as part of my doctoral program. So, I really got to spend time with our GI team at General Physician, especially Dr. Corsanti. So, and it was really eye-opening, and it was really helpful to watch procedures and colonoscopies and things like that. And why I bring that up is I was also able to go in when he was seeing patients, and it's really interesting to see that the GI doctors, even, they ask a lot of questions that we ask as well as dietitians, like looking at lifestyle, and because it really is all encompassing. And sometimes, as I said, you might have symptoms. I could have three people. You could all have the same symptoms, but you're all going to perceive them differently, right? The severity of the symptoms. But a lot of times, how do you know? When people come in and they're like, I have, difficulty swallowing, or food gets caught, or I have constant burning in my stomach or in my chest. Maybe they have severe bloating and gas, like all of the time. Most commonly, we see patients, they are severely constipated. I have some patients that have a bowel movement once a week, which is not great, once every 2 weeks, or they're having multiple bowel movements all the time, meaning they are going 4 or 5, some people 8 to 10 times a day, where they're like, I can't leave the house. I can't go anywhere because I'm afraid I'll have to go to the bathroom. And those are just the ones you notice. Like with liver, for some patients, they don't notice it till it's really significantly progressed, with the liver disease and function. So some of them, I think, when they're in their early stages, you'll notice it sooner than other individuals when they become more progressive, if that makes sense. So it depends on what area of the body it's impacting.
Well, you know what? And you mentioned liver. You said 25% of the country has a fatty liver disease. Can you feel it? Is that something? What would be a symptom of your liver possibly, needing to see your primary care about what does it feel like? Are there any symptoms?
So for some people they do, but I will tell you, and I talk about that in a second, but I will tell you that most of them don't notice it in those early stages, right? Because we even have kids that have this fatty liver disease. But a lot of times it might be fatigue or not feeling well. And you might get pain or discomfort in the upper kind of right belly region. Then, when it gets really progressive, people will find that they might be getting fluid buildup. You'll feel it around the belly or the stomach. They might get swelling in the legs, jaundice or yellowing. That's more severe. But I will tell you that most doctors are checking, especially when someone is with obesity now, which is really common, right? 42% of the national population here in the US, that they're checking liver enzymes. So a lot of times that's the first step, is looking at those liver enzymes. And I just want to throw something in here because a lot of people don't understand this. So every part of your body, right, is fed by your GI tract, meaning like you need the nutrition and the nutrients. But the interesting part is that the portal vein, and it's the one time in the body where the blood is carried to something. Veins carry blood away from the organs, but it's the one time that it carries it to an organ. But the gastrointestinal tract, so all the blood from that biliary system and the GI system really gets dumped into the liver, right? Because the liver filters everything. And the interesting part is that the diet that you have directly impacts the liver, right? It's the first organ being fed. And we find that a lot of this fatty liver, they're calling now a metabolic dysfunction, right? People always think of fatty liver as from alcohol, and it can be, but this non-alcoholic fatty liver, it really is from diet. It's diet and lifestyle. It's obesity, and it's the standard American diet.
Okay, so is there anything we can do to clean the liver? If someone can, would they make an appointment to see you, or is there anything, listeners can stop doing and start doing? Can a stop and a start?
Absolutely. So there's a lot of things that can help the liver, and, keeping blood pressure in check, believe it or not. So watching sodium intake, eating that healthy diet of fruits and vegetables. I know I say this, Fran, on every single show, your fruits and vegetables.
Right. Yeah.
High fiber keeps the GI tract healthy, the bowel movements, it keeps the liver healthy. Eating foods that have pre and probiotics in them. So fiber is part of that, but is also like cultured foods like yogurt and kimchi and even doing like apple cider vinegar. Those kinds of things can help the help the GI tract and the liver, lower fat. So when someone comes in to us, we look at all that and try to put them on the right track. There's no way to cleanse the liver. You'll see a lot of that anecdotal stuff, like do a cleanse. Your kidneys and your liver filter and do what they need to do for the body. Because if they're not, you're not going to be in a good place health-wise, right? So a lot of the stuff out there is anecdotal. How do you clean the liver? Just eat healthy. So if they want to come and see myself or my team, and a lot of times we are covered by insurance plans, many times, the number to call for us is 716-748-4000. And we do require a referral from your doctor, but most any doctor will give you a referral. They usually are excited that you want to come to see us, to see the dietitians.
Yeah. And say your phone number one more time, please.
Yes, it is 716-748-4000. So 716-748-4000.
4,000. Thank you. What should a healthy GI feel like? So what should a healthy gastrological tract feel like? I mean, you talk about your belly, your throat, no constipation. What should you feel like?
You really should feel, again, as if it's really complex, but overall, if your GI tract's, in a good place, I'll call it, again, there's a lot more to it, but it's one of those when you eat your foods, meaning you don't feel overly bloated, abdominal pain, gas, you feel that you're having good daily bowel movements, you have good energy, good sleep. And think about it too, if your GI tract's doing its job, your hair, skin, nails, all of those things will, essentially be in good condition. Now, granted, it's based on what you're eating, but you will feel healthy. I know that's, you will feel strong and healthy. And it's just feeling good. I call it vitality, right? So you feel you have that vitality.
Okay. Another question, because I've met little kids who have said they can't eat different things because they have acid reflux. How early can someone be born with a compromised GI system?
Oh, absolutely. So you can be born with motility issues. There are also what we call congenital gastrointestinal anomalies. So sometimes you have an underdeveloped organ. Sometimes you have twisted organs. Maybe there's a blockage in there. We're looking now at these autoimmune diseases like ulcerative colitis and Crohn's. There is thought that there's a genetic link to it. Now, by the way, that doesn't mean you necessarily are going to develop it, right? Because you have a gene, it means you have a higher, let's say, predisposition to it. But those are things that you can be born with, or the susceptibility to something that will put you at higher risk. Celiac disease is another one. So these are things that can impact, again, from an early age for some individuals, because there are younger children and toddlers that have been diagnosed with Crohn's and celiac disease.
Mhm. We only have a few minutes left, but so what are some of the key tips, the key takeaways that our listeners should, at least listen to and try and stick to, to adopt for a healthy stomach, a healthy gut, healthy digestive system? What are a few tips that they can start tomorrow?
Believe it or not, exercise, I mean, it helps, of course, with weight as well, but exercise a lot of times can help get the GI tract moving. So good bowel movements, a good diet, avoiding that standard American diet, eating your fruits and vegetables, and I cannot stress fiber enough. There are many times even taking Metamucil, talk to your doctor about that, but can be beneficial. That psyllium husk fiber can help with cholesterol levels, but can also help bulk your stools. So eating that healthy diet, avoiding the sugar, avoiding what you talked about. I know football season's coming up, but bring or make sure there's a healthy choice available. If you're making a dip, use the lower fat cheese in there, the lower fat or fat-free sour cream. There are ways to make those recipes healthy and they still taste great. Making sure that you are, again, watch your bowel movements, make sure that you're having a good bowel movement every day. And like I said, if you're not, speak with your doctor, monitoring those symptoms. If you notice you're having some significant symptoms, don't ignore it. Make sure you call the doctor and make sure that someone's assessing it. And then bottom line too, I said to increase fiber, you got to make sure that you increase your fluid intake. So staying hydrated and making sure your beverage is water and not something that's pop or juice. I'm okay with sugar-free beverages, but there are some studies now showing that those artificial sweeteners may be disruptive to the microbiome. So if you're going to have a diet iced tea or pop or something, make sure it's, maybe a 12-ounce can or less per day. So keep that limited as well.
And Kelly, on that note, I'm going to say thank you. And if anyone has any questions about diet pop and stuff, I'm sure there are probably 300 pages on the internet talking about that. So if you don't believe Kelly, go to the internet about diet pop. So, but Kelly, this is not our last time on the Great Lakes Health Radio program, but I want to thank you again so much for being our guest and guests. I have to let you know, Kelly does do public speaking. I've had her at several events in the community. She's very relatable when it comes to maintaining a healthy GI, gastrological digestive system. So again, Kelly, thank you so much for being our guest today on the Great Lakes Health Radio program.
Thank you. I always appreciate it. Thanks again.
Thank you. And guests, don't change that dial. Part 2 of our program is coming up with Dr. Fred Archer III talking about maternal and infant mortality. So please, I will be back with you within 4 seconds. And now on to part 2. And you know what? This year, I'm just really trying to focus more in the area of employment and careers. And so for today, again, I'm your host, Francesca Messiah from Kaleida Health, Manager, Workforce Development. And I appreciate you listening and staying with us for the second half hour of the program. Or if you're just joining at 7:30, welcome, welcome, welcome. And our guest for today is Angela Mosteller. And Angela is HR, Human Resources, and the Long-Term Care Talent Acquisition Partner, which means she's responsible for hiring and tying it into our topic for today, which is careers and employment in long-term care. So Angela is HR, Human Resources, Long-Term Care Talent Acquisition Partner, responsible for hiring at High Point on Michigan and DeGraff Skilled Nursing Facility. Welcome, Angela. How are you today?
I'm doing well. Thank you for having me today.
Oh, wonderful. Angela, I know you've been on before, and I forgot when. However, I know a lot of people when I'm in the community, people still don't understand what is long-term care? So if they're interested in this area of going online, applying to Kaleida, what is long-term care? And could you provide some examples of the services that are needed at Kaleida Health long-term care? It's a long question. And what are the hours of long-term care facilities?
Absolutely. So a lot of people are not aware that Kaleida Health has two long-term skilled nursing facilities, which include High Point on Michigan, which is located in a downtown Buffalo Medical Campus area, along with the DeGraff Skilled Nursing Facility, which is located in North Tonawanda, right behind DeGraff Memorial Hospital. Long-term care and short-term care, what we do is we take care of the needs of those who are not physically capable of taking care of themselves, or whether they're here for intense physical therapy after, a knee replacement, hip replacement, motor vehicle accidents, or if they're just in need of strengthening after being hospitalized for quite some time. So we provide services to those who need that extra assistance in their everyday routines.
And what are the hours of a long-term care facility?
Well, this is a 24-hour facility, open 7 days a week, 365 days a year. So we have 24-hour continuous care for our patients, residents, and the children that we service.
Yeah. And I also want our listeners to know that all of our hospitals are also 24 hours a day, 7 days a week. We don't close on Christmas or any of the holidays because we're providing services. What are some of so if someone is looking at the Kaleida website, so if they were to go to Kaleida Health and type in, and then when the bar comes up, type in careers, they're looking at that site. How would they apply for a job, and what type of jobs are available in long-term care?
Absolutely. So we encourage people to visit our website, which is www.kaleidahealth.org/careers, and take a look at all the career opportunities that Kaleida Health has to offer. You can punch in codes such as High Point, DeGraff, Buffalo General, or for the long-term care facilities, that the positions that we recruit for are nursing personnel, which include licensed practical nurses, registered nurses, New York State certified nursing assistants. We also offer a paid CNA training program here at High Point on Michigan for those who are pursuing career opportunities as a certified nursing assistant for both High Point on Michigan and DeGraff Skilled Nursing Facility, which is located in North Tonawanda. We're also a testing site where we test the CNA trainees to become New York State certified and have a career opportunity within our long-term skilled nursing facility. Those are just to name a few of the positions that we currently interview for. We also have entry-level positions such as nutritional food service aides and environmental services. We have physical therapy positions for physical therapy, occupational therapy, respiratory therapists. We also have administrative positions available here at our long-term care healthcare facilities.
What if, a lot of times in the community, someone may say, I'm interested in a position in dietary or a position in environmental services, which are positions that are available at High Point and DeGraff. If someone has been, let's say this person is 18, and because that's when you can apply for jobs at Kaleida, you must be 18 in order to be hired. But for the past 8 years or 10 years, because they're the oldest member in their family, they've been cooking for their siblings. They've been making sure that their siblings are out the door in the morning for school. They're cleaning up around the house after they get home from school. How does that type of information, is that valuable information to include on your resume?
Absolutely. Even though experience is preferred, it's definitely not required. There's always people seeking different career opportunities, to find their niche. We also offer opportunities for them to volunteer here at our healthcare organization, where it allows them the opportunity to work alongside of the healthcare professionals to see if that's a career path that they're interested in pursuing. If you're taking care of someone at home, whether, it's someone who is elderly or, any family for that manner, you could definitely put that in the resume, um, letting us know that, you have some experience taking care of others or that customer service that we're looking for.
Right. And you said the key word, the word is experience. And I have to admit, how I really found, became in touch with that type of information, things that you do around the house. It's not just housework. Is when I was in a organization called when I was active with the organization called the Junior League. And that's one of the things they talked about was turning your life experiences, things you've been doing for years at home. You could be taking care of an elderly loved one who is unable to move around, and you're that caregiver. Please put that type of information in the section of the resume that talks about experience, because that is experience, and never discount the experience that you're doing for your loved ones at home. I just had to say that. Positions. What are some of the positions that need immediate filling?
Currently at this time, we are looking for nursing personnel. Nursing personnel includes registered nurses. We do have open positions for nursing supervisors, along with unit managers. We also have weekend warrior positions, and weekend warrior positions is for those who are looking for just weekend positions, that'll free up your time during the actual work week. But we do offer 12-hour shifts, whether it's 7 a.m. till 7:30 p.m. or 7:30 p.m. till 7 a.m. for registered nurses who are looking for a career path in supervision or a unit manager position. We're also recruiting for licensed practical nurses as well for our evening shift, which include 3 p.m. to 11 p.m. May have some day shift positions available as well. New York State certified nursing assistants, we're always in need of, for those who are looking for those career paths. So nursing personnel at this time is where we're trying to get the word out for those who are interested in joining Kaleida Health's long-term care facilities.
Mm-hmm. Now, let's say you're at a job fair, and someone expressed an interest. You take their name. Do they have to fill out an application, or is just talking to you good enough?
No, absolutely. We definitely encourage for you to be considered for a career opportunity within our Kaleida organization. A application must be completed. You can always call and inquire to see the type of positions that we have available. But in order to be part of the interview process, an application must be completed on our Kaleida Health's career page.
And on that note, I want to add, if your computer isn't working at home, or if somebody else is on the computer, what do they say, hogging the computer? The second floor at Buffalo General Hospital, there's a computer. I don't know if you have one at High Point, but I know we have a computer where you can go online and complete your application. And you know what? And bring your resume with you. And I know there's someone who can show you how to download that application. And I want to say, is a resume required for the positions at High Point and DeGrasse?
We prefer resume for certain positions that we do interview for. As far as a resume gets a little bit more in depth as past experience. So we do encourage, if you do have a resume, submit your application into your Kaleida Health profile when submitting that application. If not, you don't have to have a resume.
Okay, thank you. School is almost over, and there are going to be lots of people. There will be students graduating from many of our area high schools in Buffalo south of here, north of here, Buffalo, do they have to, and they're interested in healthcare, they're interested in nursing, and they're interested in applying for the CNA, Certified Nursing Assistant position. Do they have to have experience in that area to get hired? If not, what does that mean?
Experience is not required. It is preferred. For those who are interested in joining our paid CNA training program, we encourage that you submit your applications as soon as possible for our next upcoming paid CNA class. Just go into our careers page, type in nurse aid trainee for your designated location, that which is either High Point on Michigan in downtown Buffalo or DeGraff Skilled Nursing Facility in North Tonawanda. Our classes are held at our High Point on Michigan location for 4 consecutive weeks, and upon graduation, you can go right back to your designated facility to continue working as a certified nursing assistant.
Now, what are the hours of the training?
Our training class is Monday through Friday, 7 a.m. till 3 p.m. for 4 consecutive weeks. We do have our nurse aid trainees work as pre-CNA trainees, and this allows them the opportunity to work alongside of other certified nursing assistants so that they can see what they do on a day-to-day basis. A lot of people have a perception of what New York State certified nursing assistants do. So this opportunity allows them to actually see the everyday functions of the job role and responsibilities and ask those certified nursing assistants questions that they may have prior into getting into the CNA training program.
Mm-hmm. So it's like a almost a peer-to-peer observation, peer-to-peer training, where they might be more comfortable asking somebody, and there are no dumb questions, but they may be more comfortable asking their peer who they're training next to. Is that kind of the idea behind that?
Absolutely. It's, the opportunity to see what New York State certified nursing assistants do, see what the everyday job function is, have that patient and resident interaction along with our children, and it also gives the employer the opportunity to monitor, patient interaction, just to make sure that they're a qualified candidate to be in our paid CNA training program. We're looking for caring, compassionate people who are here to make the last years of their lives the most memorable, and just make them comfortable, looking for some type of companionship for our elderly population.
Mm-hmm. Now, once someone is, let's say they're hired, they've gone through the training, but they really want to work a different shift, like a night shift. Is that possible? And what are the different shifts that CNA, Certified Nursing Assistants, work at High Point and DeGraff Skilled Nursing Facility?
The benefits of working for our long-term skilled nursing facilities is that it is a 24-hour facility. We're open 24 hours a day, 7 days a week, 365 days a year. So it allows individuals the opportunity to pick a shift that works for them or their families. So our shifts at High Point include days, evenings, and overnights, which are 7 a.m. to 3 p.m., 3 p.m. to 11 p.m., and 11 p.m. till 7 a.m. Over at our DeGraff Skilled Nursing facilities, their hours are 6 a.m. to 2 p.m., 2 p.m. till 10 p.m., and 10 p.m. till 6 a.m.
Mm-hmm. So as you see, there is flexibility in working as a certified nursing assistant or working in long-term care.
Absolutely. So at the completion of their paid training program, we sit with the individuals to make sure we find a shift that works best for them.
Mm-hmm. Wow, that sounds very inviting. How about open interviews? Can you explain? I know you have signs up sometimes around High Point on Michigan long-term care, and it says open interviews now taking. What does the sign say? I know it says something.
So we have our upcoming open interviews at our long-term care facility. Just to put some dates out there, on June 5th, DeGraff Nursing Facility will be hosting open interviews, allows individuals the opportunity to come meet with the talent acquisition team and find a position, you know, that fits them or that they're experienced for. Uh, June 18th, which is a Tuesday, we'll be hosting open interviews at High Point on Michigan, which is located in downtown Buffalo. And at that time, we are looking for nursing personnel, again, which include registered nurses, LPNs, certified nursing assistants, or those who are interested in our nurse aid training program. We encourage that you visit the sites during the open interviews, come in with your 2 forms of ID, a New York State ID card that is not expired, you know, a second form of ID, which includes social security card or birth certificate, or a passport if you have that available. Meet with the hiring managers, and we are offering on the spot job offers.
On the spot, people, listener, did you hear that? It's for you, it's for your children, your grandchildren. On the spot job interviews. Could you just say those 2 dates again for open interviews and the positions you're hiring, you're specifically interested in?
Yes, for our North Tonawanda location, it will be on Wednesday, June 5th, between the hours of 1 p.m. till 6 p.m. And then on Tuesday, June 18th, for High Point on Michigan, which is located in downtown Buffalo. DeGraff Nursing Facility is located at 445 Tremont Avenue in North Tonawanda, and High Point on Michigan is located at 1031 Michigan Avenue in Buffalo, New York.
And what's the time again on June 18th?
From
At High
1
Point?
p.m. from 1 p.m. till 6 p.m.
Oh, both. Okay, they both have the same times.
Yes.
Okay. Should someone bring? Should a listener? Should someone bring their resume with them, or isn't that necessary?
Yeah, if they have a resume, they can bring the resume with them at that time for the open interviews. But most importantly is having that application on file on our careers page.
Okay, that sounds great. How about the Juneteenth tent? Juneteenth is at Martin Luther King Park, and Kaleida Health and ECMC for many years have been sponsors of the Health Pavilion. Are you going to be Are you going to be there, Angela, with career information, employment information for High Point on Michigan and DeGraff Skilled Nursing Facility?
I would tell everyone to please stop at the Kaleida Health career tent at the Juneteenth, and I will be there to meet those who are interested in seeking career opportunities.
What shift are you going to be there?
I will let
We have
you
two.
know. I know we have 2 shifts, and I will get
Okay.
that information out to you as soon as possible.
Okay, and because we know Angela will be there, and if you're listening right now, please stop under the tent, because if she's on the second shift that begins at 1 p.m., the first shift begins at 10:45. But you know what? If you're just walking by, getting ready for the Juneteenth parade, you see the Health Pavilion, just stop in, ask for me, Francesca Messiah. If Angela isn't there, I will have her contact information in case you're in the parade, you're marching in the parade, and you won't have a chance to get back. So please stop under the health, the pavilion. Angela, what are some of the benefits of working at High Point or DeGraff?
Not only do we offer you a job, we offer you plenty of career opportunities. There's definitely a career ladder within the Kaleida organization for you to grow within the actual company. We offer paid time off. We offer, tuition assistance programs for those who want to further their education in different career paths, pension plans, health insurance benefits, dental, flex spending. There's so many benefits for working for the Kaleida organization. And let's not forget our employee discount programs as well.
Yes, our employee discount program is huge. It's everything from travel to car wash, discounts to our large stores, like I call them superstores, like Sam's Club, and we don't have Costco. We have BJ's. We have hundreds and hundreds of discounts for Kaleida employees, and you have Kaleida Buffalo Bills swag. So we just have a lot of really great. There are many great reasons to join. Angela, we have around we have a couple minutes left, about a good 5 minutes. Anything I haven't touched on that you want to discuss, or something you want to reinforce that you have touched on?
I think we've pretty much touched on everything. If anyone has any additional questions, please feel free to reach out to me. Again, my name is Angela Mosteller. I work with the HR department. I am Senior Talent Acquisition Partner for Long-Term Care, which includes High Point on Michigan and DeGraff Skilled Nursing Facility. You can text me at area code 716-913-6121. Again, that's 716-913-6121. Text me regarding career opportunities, or you can send me an email, which is armosteller, which is MOSTILLER at KaleidaHealth.org.
And you know what, Angela, what I'm going to have you say your text number a little slower, and I'm going to just have you repeat your email address for additional questions.
Yes, 716-913-6121. Again, that's 716-913-6121. You can shoot me a text message, or you can send an email at armosteller at KaleidaHealth.com. And that's ARMOSTILLER at KaleidaHealth.org.
Okay. Thank you. And I know we still have a couple minutes, so I just want to ask you a little more about this training program. So a listener doesn't have any experience. They're still wondering, how can they have no experience, go through a training program and get paid? So if you could talk a little bit about that, it just seems too good to be true. If you could just share a little how that works.
So it's a paid CNA training program, which is for our Kaleida long-term care facilities. And the paid CNA training program are for those who would like to pursue a career in healthcare. And again, that's taking care of our elderly population. It's paid training Monday through Friday, 7 a.m. to 3 p.m. And we're just looking for those individuals who wants to make a difference in others' lives. Again, who are caring, who are compassionate, who are reliable, dependable, want to take care of the elderly population. Another unique thing as well is that it allows them the opportunity to work alongside of our children. High Point on Michigan has a pediatric unit that we take care of younger children as well. So it's not just elderly patients and residents, we service children. So for those who are interested in our paid CNA training program, please visit our website at the KaleidaHealth.org/careers page. Type in nurse aid trainee and complete an application so we can review your application, bring you in for initial interview, provide you with a tour of the actual facility, and see if you're a potential candidate for our paid CNA training program.
And I also want to say something to our listeners. I just found out last week, Angela walks a walk, talks a talk. And Angela, how was it you got your career? You don't have to mention where it was you started, but because you had a good personality, something like that?
Well, I thank you very much. I started my career path in a long-term skilled nursing facility as well. I wasn't sure exactly what I wanted to do, but it was the opportunity to work alongside those healthcare professionals. And to be honest, I got into healthcare working as a certified nursing assistant. And I've been working in healthcare now for 26 years, a little over 26 years. And my CNA certification allowed me the opportunity to explore different career opportunities within the healthcare industry. And, sometimes you just have to follow certain career paths. And my CNA certification led me to a career path working in human resources.
And I remember when you were speaking last week to the AHAC students, you talked about being prompt, and that helped you in your career, right? Just being early, being on time for work.
Absolutely, being reliable, being dependable, knowing that my employer knew that I was going to come to work every day on time and perform the job duties that was expected from me, which are very important, when you're expressing different, interests and growing and following that career ladder within the organization, you know, looking for dependable people, honest people who are going to come to work every day and know that this is a 24-hour organization taking care of our patiently and residents. And, our patients and residents deserve, that they have someone that they can rely on and depend on to be here every day.
And Angela, and on that note, I just want to say thank you. And those are during open interviews, those are the types of qualities I'm sure Angela is looking for in you. You, the listener, interested. If you're interested in working at, finding out more about working at High Point on Michigan or DeGraff, remember the 2 dates, June 5th, 445 Tremont Avenue, 1 p.m. to 6 p.m., June 18th, again, at the corner of Michigan and High Street, High Point, again, 1 p.m. till 6 p.m. Angela, I want to thank you for being our guest this morning on the Great Lakes Health radio program. Thank you.
Francesca, thank you so much for having me.
Oh, you're welcome. Next week, you'll hear from my esteemed colleague, Cindy Bass from Erie County Medical Center, ECMC. I want to thank you from the bottom of my heart for listening to the Great Lakes Health radio program. And in 2 weeks, God be willing, you will hear me again. Francesca Messiah, Manager, Workforce Development, Kaleida Health. Thank you. Have a blessed day. Bye-bye.